Medicos, good day to all of you. This is Dr. BK for you, and today I am going to speak about the deep perineal pouch and the perineal body. So, our learning objectives for today will be about a short introduction about the deep perineal pouch. So what is basically a deep perineal pouch? The boundaries of the deep perineal pouch extend the various walls of the deep perineal pouch. Contents of the deep perineal pouch, mainly the muscles, vessels and nerves, form the deep perineal pouch, and of course it is also pierced by two other important structures. And then what is urogenital diaphragm? So where actually it is present, and in what way it helps as a diaphragm to support the pelvic viscera. Then finally we will conclude with the clinical aspects. So before that, of course, we will be discussing even about the perineal membrane and also the perineal body. Now, where actually the deep perineal pouch is situated? Now, if you look at the perineum, we have already discussed in the last class in the introduction to perineum and about the superficial perineal pouch. The perineum can be divided into an anterior urogenital triangle and the posterior anal triangle by a imaginary plane which is connecting the two ischial tuberosity. Now, below the pelvic diaphragm, so this is your pelvic diaphragm, below the pelvic diaphragm, the anterior part of the outlet of pelvis, the pelvic outlet, is actually closed. So this is your anterior part of the pelvic outlet, which is closed by the urogenital diaphragm. So an enlarged view you are able to see here. Immediately below the levator ani muscle or the pelvic diaphragm, in the anterior part of the pelvic outlet, you see another diaphragm, and that is closed on all sides and forms a pouch which is called as the deep perineal pouch. Now why it is called as deep perineal pouch? Because it is deeper to the superficial perineal pouch. So situated in the anterior part of the pelvic outlet and below the pelvic diaphragm. So as I told you, it is situated in the anterior part of the perineum, that is the urogenital triangle. Okay, urogenital triangle and urogenital diaphragm is different. Don't get confused with these two terms. It is an interfacial space, which means it is lined by fascia above, below, anteriorly in front and posteriorly behind. So completely surrounded by the fascia, a space, and definitely it is a closed space, closed on all sides. Okay, but of course it is pierced by the urethra. So the urethra traverses, makes an opening into the space, and of course it has to exit out. That opening is there. And in case of females, definitely behind the urethra you have the vaginal canal also traversing. So apart from that, transmitting these structures, it is completely closed on all sides. And where actually it is situated? It is situated above the perineal membrane. So this is the perineal membrane, which itself forms a facial covering for this deep pouch. Okay, so which itself forms a facial covering. So inferior covering for the pouch itself is by the perineal membrane. So that is, I think this should have given you a fairer or a clear idea about the deep perineal pouch. So as I told you, the contents of the pouch here in a sagittal section you are seeing, it is completely surrounded by the fascia. below, above, anteriorly and posteriorly. Okay, but traversed by the urethra in males, and females, apart from the urethra, it is the vaginal canal which is also traversing. Okay, and this is your levator ani muscle which forms the pelvic diaphragm. So below the pelvic diaphragm, the anterior part of the pelvic outlet, and the perineum, it is situated in the urogenital triangle. So is that clear? And of course, as I told you, it is a closed space. Now, this you are able to see a very simple graphical or a diagrammatic representation of the deep perineal pouch to understand the boundaries. Okay. Now here I would like to make clear one thing is the space is actually not a two-dimensional structures. Okay. Like the muscles which are covered by fascia on either side. It is not like that, because first of all your sphincter urethrae muscle itself extends throughout the length of the membranous urethra. Okay, longitudinally it is oriented, not something which is transversely oriented. Same way, these structures are all longitudinal structures. And now the latest version of with respect to the deep perineal pouches, certain authors, they challenge the existence of such a pouch which is represented as two-dimensional. Okay, so above, it is by the superior fascia. You are able to see here, it is covered by the fascia. These muscles are covered by a fascia which is the superior fascia of urogenital diaphragm. So that is the above limit or the superior limit of the deep perineal pouch. Below, it is by the inferior fascia of the urogenital diaphragm, which is comparatively thicker than the superior fascia. The inferior fascia of the urogenital diaphragm is nothing but called as the perineal membrane. So here I would like to stress again that the perineal membrane and the inferior fascia of urogenital diaphragm is one and the same. So above superior fascia, below actually the inferior fascia of urogenital diaphragm, that is the perineal membrane. Then in front, it is the transverse perineal ligament. So the transverse perineal ligament is again nothing but the thickening of the perineal membrane. So the perineal membrane thickens and attaches or bridges across the inferior ramus of pubis as the transverse perineal ligament, and it is closed because the superior fascia comes and merges with the transverse perineal ligament, so it is closed in the front. Okay, so that is the transverse perineal ligament. Behind, it is again the fusion of the superior fascia and inferior fascia. So both the layers, superior and inferior layers, fuse, and behind also they close. You are able to understand here. Actually, in the midline posteriorly, you are able to see a center point, and that part is actually the perineal body is situated here, which is a fibromuscular node. So I will come to the perineal body later. So laterally, it is on either side. You have the ischiopubic rami or conjoint ischiopubic rami, the pelvic surface or the inner surface of the ischiopubic rami. Okay. So on either side, you are able to see the ischiopubic rami forming the lateral boundary. This is actually the perineal membrane which is reflected for you. So the perineal membrane anteriorly, it is thickened to form the transverse perineal ligament. Behind, it has fused with the superior fascia. So once you reflect the perineal ligament, here you are able to see the muscles of the deep perineal pouch. Two muscles are there. I will come to it in a short while. And it is a female perineum. So in the front, it is pierced by the urethra, and behind it is actually pierced by the vaginal canal. So once you close this, or here you are able to see, so superior or superficial to the perineal membrane, you are able to see this is greater vestibular gland. So you are the vestibule of the female reproductive or external genitalia, which is a part of superficial perineal pouch. So the perineal membrane demarcates or divides, or it is the boundary line between the superficial perineal pouch and the deep perineal pouch. So above the perineal membrane it is deep perineal pouch, below the perineal membrane it is the superficial perineal pouch, and so the lateral boundary is the conjoint ischiopubic rami. So what are the contents? So mainly it is made up of pierced by the membranous urethra. So the urethra in case of males, after traversing the prostate gland, prostatic part of urethra, immediately pierces this deep perineal pouch. Then inside, so the facial layers, you are able to see the perineal membrane has been reflected, so you are able to see the contents, urethra. On either side of the urethra, again in case of males, you see the bulbourethral glands. Okay, so the bulbourethral glands are also seen on either side of the urethra. In females, behind the urethra, you see the vagina apart from the urethra. Okay, muscles, two muscles. One is the deep transverse perineal, which is seen on the posterior aspect of the deep perineal pouch. So that is the deep transverse perineum of both these sides, and this part should be your perineal body where it is getting inserted. The other muscle is the sphincter urethrae. So it actually surrounds the urethra and constricts the urethra, membranous part of urethra. So that is why it is actually called as the sphincter urethrae. So mainly it consists of two muscles. That is the deep transverse perineum and sphincter urethrae. It is pierced by urethra. Content is urethra, membranous part of urethra in males, and bulbourethral glands. In females, urethra and vagina behind the urethra, no bulbourethral glands in case of the females. Instead, we have the paraurethral glands, greater vestibular glands. Okay. What are the vessels which you see in the deep perineal pouch? Deep artery of penis or clitoris. Deep artery of penis or clitoris. Dorsal artery of penis or clitoris. So these two are again branches of the internal pudendal artery. So they are the terminal branches of the internal pudendal artery. So internal pudendal artery will be seen along the lateral wall in the ischiorectal fossa, the pudendal canal, and what happens is they give branches in the canal, and ultimately what happens in the anterior part, they divide into the deep artery of penis or clitoris in case of females, and dorsal artery of penis or clitoris. So these vessels and the nerves, mainly what you come across is the dorsal nerve of penis or clitoris. Okay, so the dorsal nerve of penis or clitoris is again a sensory nerve. So it is a cutaneous nerve which mainly supplies the dorsal aspect of your penis in case of males and clitoris in case of females. So mainly two muscles, vessels are deep artery of penis and dorsal artery of penis or clitoris. Nerves is dorsal nerve of penis or clitoris. Then of course you have the muscular branches which is going to supply your sphincter urethrae and the deep transverse perineum. Okay. So now contents we have seen about these structures, that is the deep perineal pouch, urethra, then you have the bulbourethral glands in males, then urethra and vagina in case of females, then we have seen about the muscles and vessels. Now what is urogenital diaphragm? Again it is a musculofacial partition. Okay. So here you are able to see two fascia with muscles. Is the urogenital diaphragm. It is nothing but the deep pouch and the urogenital diaphragm both refers to the same. So then you might ask, what is the difference? So deep pouch means you have to write about, apart from the muscles, it is pierced by these urethra, vagina, bulbourethral glands, Then about the muscles and the vessels, as I told you, deep artery and dorsal artery of penis or clitoris. Then you have to write about the nerve, that is the dorsal nerve of penis or clitoris, which is seen in the pouch, and then the muscular branches. But when it comes to a diaphragm, it should be a facial or a muscular structure. So only the muscle with the facial covering, when you describe it, becomes the urogenital diaphragm. So this we would have discussed this in the superficial perineal pouch. So for you to understand here, so we are actually tracing the fascia from the anterior abdominal wall. So this is superficial fascia with the fat fascia of camphor. Then this is actually the membranous layer, which is actually called as the fascia scarpa. So the fascia scarpa enters into the perineum as the fascia collis, and anteriorly it is continuous with the fascia of the penis, then fascia of the scrotum. So which is nothing but the modification of the fascia of collis fascia, and then ultimately what happens is finally it goes behind the root of the penis and gets attached to the perineal membrane. So now this part is your superficial perineal pouch. The deep perineal pouch, which is actually formed by the facial layer, perineal membrane, which forms the inferior fascia of urogenital diaphragm. And then above we have the superior fascia of urogenital diaphragm, and both are fused in front and behind. So thereby we have a closed diaphragm, which is an interfacial structure. So between the two fascia we have two muscles, and that is your urogenital diaphragm, which is nothing but your deep pouch. So the urogenital diaphragm, as I told you, it is mainly made up of the muscles. So that is why I am discussing the muscles here. Sphincter urethrae. So it encircles the membranous part of urethra, and it has got superficial set of fibers, and also it has deep set of fibers. So arises from the transverse perineal ligament, and also from the ischiopubic rami. Then it is actually encircles and inserted into the perineal body. These are the deep fibers. Actually they arise again from the junction of ischiopubic rami and the pudendal canal. At that place they arise, and the fibers are actually continuous with the fibers of the opposite side. So thereby they form a sphincter like structure, and they are actually getting inserted into the perineal body. That is about the sphincter urethrae muscle. Deep transverse perineum, you are able to see here, present behind the sphincter urethra, arises from the ramus of ischium. So it actually arises from the ramus of ischium and inserted into the perineal body. Okay. So these two are actually forming an extra support below the pelvic diaphragm, because it has to bear the brunt of the urinary bladder, in case of females bladder, and also the uterus, which is immediately present above. So of course immediately above it what you have is the pelvic diaphragm, and above that. But since it is pierced by two structures anteriorly, urethra and the vaginal canal, so you have an extra facial like diaphragm, and it is mainly responsible for acting on the urethra as well as the vaginal canal in case of female. So I will come to that in the actions or functions of the urogenital diaphragm. So two muscles, mainly the sphincter urethrae, and other one is the deep transverse perineum. So mainly they are supplied by the perineal nerve. So perineal nerve gives muscular branches, that is the S4 nerve, fourth sacral nerve. So the muscles are covered by the fascia. So superiorly by the superior fascia of urogenital diaphragm, and inferiorly by the inferior fascia of the urogenital diaphragm, which is actually called as the perineal membrane. When you compare these two, the superior fascia is actually very thin, and anteriorly what happens, In front it merges with the fuses with the inferior fascia, which we have seen here. So merges with the inferior fascia and actually closes the pouch. Okay. Then at the sides it is attached to the ischiopubic rami and continues with the obturator fascia. So you are able to the obturator internus muscle, which is covered by the obturator fascia. This is the levator ani muscle, which is actually converging to form the pelvic diaphragm, and that is again covered by the fascia, superior fascia and inferior fascia of pelvic diaphragm. Okay, levator ani muscle forms it, and the place of attachment of this fascia, the obturator fascia, is the white line of tendinous arch. Okay, so these things all I have again described in my pelvic diaphragm class. So here mainly the superior fascia, what happens is in front it blends with the inferior fascia, that is to the transverse perineal ligament. Sides attaches to the ischiopubic rami and continues with the obturator fascia. Same way posteriorly also what happens, it is actually attached to the perineal membrane and closes the urogenital diaphragm. Below, this fascia below is reflected onto the sides of the urethra. So this fascia is actually attached to the sides, along the sides of the urethra it reflects. So below and in the midline. Okay. So that is the membranous part of urethra you are seeing, and on either side you are able to see the bulbourethral glands. Okay, which are the contents of the deep perineal pouch. Urethra, bulbourethral glands. Then of course we have seen what other structures. We have seen the deep artery of penis. Then we have seen about the dorsal artery of penis. So deep artery of penis and the dorsal artery of penis we have seen. Then we have seen the dorsal nerve of penis or clitoris. So these are all forming the contents of the deep perineal pouch. So what are the structures piercing the urogenital diaphragm? So far we have seen about the muscles and the fascia which is covering it. What are the structures piercing this muscular component and the facial component is? It is pierced by the urethra in case of males. Then vagina behind the urethra in case of females. So the vaginal canal is actually piercing behind the urethra. Now, what are the relations of the urogenital diaphragm? So, structures piercing we have seen, the facial covering we have seen. Then coming to the relations, above it is related in case of males, prostate. Actually, the prostate gland is immediately present above the urogenital diaphragm. Okay, and then in case of females, neck of the bladder. So the urinary bladder neck is actually related in case of females. Then of course it will be related to the anterior fibers of the levator ani muscle, and sometimes the anterior recess of ischiorectal fossa. On either side of the anus you have the ischiorectal fossa. The anterior recess also comes above. So these are the relations of the urogenital diaphragm above. Okay. So prostate in case of the males, neck of urinary bladder in females, and then the fibers of the anterior fibers of levator ani and the recess of ischiorectal fossa. So that is the urogenital diaphragm which has been circled for you. Below it is related to the superficial perineal pouch and its contents. So below the urogenital diaphragm, it is related to the superficial perineal pouch and its contents. In front, it transmits the deep dorsal vein of the penis. So there is a gap between the thickening of this transverse perineal ligament, and here you have the arcuate pubic ligament. So between these two ligaments, you have a gap through which the deep dorsal vein of penis is transmitted. Then we have the dorsal nerve of penis or clitoris, okay, and behind the ischiorectal fossa. So these are the relations, okay, behind the ischiorectal fossa. Above, sometimes the anterior recess of fossa might extend. In front, deep dorsal vein of the penis, and also the dorsal nerve of penis or clitoris. So what are the functions of the urogenital diaphragm? The main functions of the urogenital diaphragm, it mainly supports the prostate gland in case of males and bladder. Fixes the perineal body because these two muscles attached to the perineal body, it helps to anchor the perineal body in its position. Then the muscles, the sphincter urethrae muscles are also distributed around the vaginal canal, so it is also forming a sphincter vaginae. Constricts the vagina especially during increased intra-abdominal pressure, coughing, sneezing, constipation, weightlifting and all those things, because otherwise what happens is the uterus might descend or prolapse. So one of these defensive mechanism is the constriction of vagina. Then sphincter urethrae constricts the membranous part of the ureter, thereby exerts voluntary control of the micturition. So when you constrict, you can hold the micturition to some extent, and not only that, it also helps to expel the last drop of the urine. So finally, the last drop of the urine, this muscle constricts to expel the last drop of urine. Okay. So these are the functions of the urogenital diaphragm. And in females, it is somewhat less defined, and it is also called as fibrous or triangular ligament. So we have discussed about the deep perineal pouch and its contents, and what is urogenital diaphragm, and what is the difference between the urogenital diaphragm and the deep perineal pouch. Now we will come to the perineal membrane. So it is a strong sheet of fascia extending along the pubic arch. So here you are able to see the pubic arch, pubic symphysis, and that is the arcuate pubic ligament, and this is the thickening of this perineal membrane as transverse perineal ligament. In the gap between these two only we have seen the deep dorsal vein of the penis or clitoris transmitted. So as I told you, the perineal membrane is triangular in shape, apex anteriorly, base posteriorly, and it forms the inferior fascia of the urogenital diaphragm or the upper limit of the superficial perineal pouch. It is tough in males, rather very thick and fibrous and tough in males because of the attachment of the root of the penis. Okay, so you are able to see the root of the penis, which consists of the two crux, and the bulb of the penis is attached to this perineal membrane. So it is very tough in case of the males. So attachments on either side pelvic surface of the ischiopubic rami. In front thickened as transverse perineal ligament. Behind it is attached to the perineal body, and before attaching it, it splits into three layers: superior or upper layer, then you have the intermediate layer which is attaching to the perineal body. Okay, so the upper layer is continuous, splits and attaches to the superior fascia of urogenital diaphragm. Okay, superior layer of urogenital diaphragm, above to the superior layer of urogenital diaphragm, around the deep transverse perineum. Below to the Colles fascia along the superficial transverse perineum to the Colles fascia. Okay, so this is the superficial perineal pouch in case of the females. So below it splits to get continuous with the Colles fascia, and in between the above and below, the intermediate part is attached to the perineal body. Okay, so anteriorly it is thickened, on either side attached to the ischiopubic rami. Below it splits into three and attaches as I have just described now. So what are the structures piercing the perineal membrane? In the midline, urethra in case of males. Then ducts of bulbourethral glands in case of males. Okay, so urethra and ducts of bulbourethral glands. On either side of the urethra, you see the ducts of bulbourethral glands. Then artery to the bulb of the penis on either side. In females, apart from the urethra, we have vagina, artery to the vestibule. So these are all branches of the pudendal artery. Artery to the bulb in case of males and artery to the vestibule. So here you are able to see the perineal membrane and the structures piercing. This is actually the artery to the bulb, which you are able to see from the internal parental artery in case of the males. In females, it is artery to the vestibule. This artery actually, okay. Other structures from anterior part, medial to lateral deep artery, we have the dorsal artery, and then you have the dorsal nerve of the penis or clitoris. Okay. So deep artery of penis, dorsal artery of penis, and deep dorsal vein at the dorsal nerve of the penis. Base, you have the posterior scrotal labial vessels. So posterior scrotal and labial vessels and nerves. Okay, posterior scrotal labial vessels and nerves. Again, they are branches of the prudental artery and prudental nerve, which you are seeing here. Posterior part of the perineal membrane is pierced by these structures. And in the gap between these two, deep dorsal vein of the penis. So between the arcuate pubic ligament and the transverse perineal ligament, we have the deep dorsal vein, which is actually going to direct to the prostatic plexus of veins. So these are the structures. Anteriorly, deep artery, dorsal artery, and the dorsal nerve of the penis or clitoris. Artery to the bulb of penis on either side of the urethra, and then posteriorly, posterior scrotal labial vessels and nerves, and in the gap between the perineal membrane and the arcuate pubic ligament, deep dorsal vein of the penis. Okay, so that is about the perineal membrane. So when a question is asked about the perineal membrane, you have to write about its definition, then its attachments, and then the structures piercing it. Now coming to the perineal body, so it is actually present almost in the center of the perineum, fibromuscular structure, which is situated base behind or close to the bulb of the penis. Whereas, and 1.25 centimeters anterior to the anal canal, but in females it is situated between the vaginal canal and the anal canal. Okay. Females, it is situated between the vaginal and the anal canal. So that is the fibromuscular node, also called as gynecological perineum, because it receives almost 9 pairs of muscles attaches to this perineal body. Uppermost part, it also receives the rectovesicular fascia. Hope you remember what is this fascia, which is present in between the rectum and the bladder. Primitive rectovesicular pouch, which also forms the floor of the Douglas pouch in case of the females, rectouterine pouch. So fascia of Denon-Villiers. So this perineal body receives muscles, 3 strata or layers. So in males, behind the bulb of the penis. So that is the bulb of the penis, and that is the crux of the penis. You are able to see these 3 form the root of the penis. Immediately behind the bulb, you are able to see the perineal body, and 1.25 centimeters ventral to the anal canal. So that is the perineal body which you are able to see here. It receives the levator ani, which forms the pelvic diaphragm. In the uppermost part, it receives the levator ani. So here it is the perineal body. Intermediate layer, it mainly receives the deep transverse perineal, sphincter urethrae, and the external part of anal sphincter. Okay. So these are all the levator ani part, pubovesicalis, pubococcygeus, and all those things. External urethral sphincter, which actually forms the sphincter urethrae, is again attached to the perineal body, and ureterovaginal sphincter is a part of the sphincter urethrae. It is a part of urethral sphincter. So all this is attached to the intermediate layer of the perineal body. Superficial layer mainly receives the bulbospongiosus muscle, which you are able to see here, which is a part of superficial perineal pouch, superficial transverse perineum, and external anal sphincter superficial part. Whereas the deep part is actually attached to the intermediate part of the perineal body. Okay. So Perineal body receives muscles in three strata, deepermost or upper strata, levator and intermediate part. Just remember the muscles of the deep perineal pouch. Along with it, you can write deep part of the external anal sphincter. Then superficial, remember the muscles of the superficial perineal pouch and along with it superficial part of external anal sphincter. So now coming to the clinical aspects, extravasation of the urine, deep extravasation, that is if there is a rupture of the membranous part of urethra, not the spongy part of urethra, the membranous part of urethra if it is ruptured. So mainly it might occur during fractures of the pelvis. When the pubic symphysis is actually dislodged or if it is disarticulated, then the deeper structure like the deep perineal pouch, there might be a rupture of the urethra. And of course, any trauma might also create what you call collection of blood, and naturally since it is a closed pouch, what happens is it cannot drag down into the superficial perineal pouch or to the anterior abdominal wall or to the inguinal space, but see it can actually escape above because around the urethra slowly it can get collect because urethra is piercing, and extra peritoneally it can collect around the prostate and the bladder. So this part it can get collected, whether the urine or the blood can get collected extra peritoneally around the prostate and the bladder. So that is about the deep extravasation of urine. Not very common. Next is perineal tear. So mainly again due to the trauma to the perineal body, or if the perineal body is incised, if it is not repaired during any surgeries of the perineum or pelvis, or during childbirth in assisted labor. So what happens is prolapse of the pelvic viscera such as urethrocoel. Okay, so what happens is the urethra tries to prolapse, which is actually called as the urethrocoel. Next is actually the cystocoel with the bladder. This is actually moderate cystocoel because only a slight part of the bladder is actually coming through the vaginal canal is prolapse. When a complete bladder or major part of the bladder comes, then it is a complete cystocoel. Then uterovaginal prolapse. So here you are able to see the prolapse of the uterus through the vagina, that is called as the uterovaginal prolapse. Then you have rectocoel. So the rectum is actually herniating or prolapse of the rectum. Okay, so through the posterior wall of the vagina. So that is called as rectocoel, and sometimes coils of intestine might lead also to enterocoel. So this is all because of the perineal body is weakened or not sutured properly. If it's not repaired properly, then these complications might occur. Next is episiotomy. So incision of the perineal body and posterior wall of the vagina. Median episiotomy is performed, or sometimes lateral episiotomy is performed, so that when the muscles which are attached here, if it is inside, it relaxes and naturally the dilatation of the vaginal canal takes place. So the head of the fetus, if it is difficult in labor to actually emerge out, then this is actually performed. And if it is not sutured properly, so as I told you, prolapse of the pelvic viscera or incontinence, urinary incontinence or fetal incontinence or anovaginal fistulas might take place. Okay, so that is about the episiotomy. So incision of the perineal body in case of arrested labor, when the fetal head is arrested during the process of labor. So thank you very much for your patient listening. We will meet again in one more lecture.